Good day, everyone. and Thank you for joining us today for our training related to Minnesota Workers' Compensation Managed Care Plan. My name is Matt Smith. I'm the Director of Training, Corvell. I'm pleased to introduce Joanne White and Kathy Johnson, who will be presenting today. Joanne and Kathy have both been in the occupational field and workers' compensation industry for many years. They've been managed care manager and managed care supervisor for Corvell for several years. Thank you for presenting today. Go ahead. Oh, before we go, I should also mention that the audience lines are muted. We're recording today's call. If you have a question, please do direct it to the chat pane or the Q&A. We'll be monitoring it throughout the call. When questions come in, I will interrupt Joanne at an appropriate time, and we can direct questions to the presenters. So go ahead, Joanne. Thank you.
Okay. Thanks a lot, Matt. And good afternoon, everybody. I want to thank you all for joining in. This is a Minnesota Workers' Compensation presentation that we're doing regarding prior notification of treatment under the Minnesota treatment parameters. We're also going to touch on the workability requirements of the providers, and if we have time, referrals within the managed care plan. We did set aside 1 hour. We will not go any longer than an hour, so just so you know, it might not even take that long. Matt's already introduced me. I'm Joanne White. I'm the managed care manager here at Corvell. Kathy Johnson is also assisting me. She's a managed care supervisor. We don't have our medical director online during this presentation, but he has been our advisor. Dr. Sean Flood is our managed care medical director. The goals today are to understand the rules of prior notification under the Minnesota Workers' Comp treatment parameters, to understand the workability requirements, and understand the process of referral under managed care. And just as a side note, we are, Kathy and I are part of the Corvell Certified Managed Care program. So we're not insurance adjusters. But we supervise a group of probably about 20 nurses, and all of our case managers not only perform case management as part of workers' comp certified managed care, but we also do utilization review, which is a little different than somebody who does traditional case management under work comp. So the most important thing to understand is that the treatment parameters are established for reasonably required treatment of the employee with compensable workers' comp injuries. And this is significant. The two phrases that are real significant here are reasonably required treatment and employees with compensable workers' compensation injuries. So prior notification is the responsibility of the provider. Under the treatment parameters, prior notification of treatment is not required for emergency treatment for obvious reasons. So that is not required. And under the treatment parameter, there are 4 different areas where prior notification is required by the provider. There are certain chronic management modalities that require prior notification. There's certain DME that requires prior notification. Non-emergency inpatient hospitalization or non-emergency inpatient surgery. And then also for treatment that departs from a parameter that is limiting the duration or the type of treatment. And I am going to go all over these. I'm going to go over these in individually to give you some specific examples. Kathy, do you want to hit on the link just to show everybody where in the rules this is listed? It's in this part 6050. It's 5221-6050. And if you scroll down to subpart 9, that is the part that talks about prior notification. And you will see that in subpart 9A, it lists the 4 areas where prior notification is required: the chronic management, the DME, inpatient hospitalization, inpatient surgery, and then also departures. Okay, so we can go on to the next slide. Okay, so for chronic modalities are listed in 5221-6600. And the chronic management modalities that require prior notification are work hardening or work conditioning programs, computerized exercise programs, so for instance your MEDEX programs, health clubs, gym memberships, chronic pain management programs, individual or group psychological or psychiatric counseling. And if you're able to hit on the link, Kathy, we can show that it's just not a matter of requesting, the physician requesting a gym membership, but there's certain information that's listed in the rules that needs to be provided. So for instance, they need to indicate why the program is being ordered. So for instance, under health clubs, the physician's got to indicate the patient's decondition, requires a structured environment. They need to document why this can't be accomplished with a home-based program of exercise. And then in the requirements, they have to have a specific prescribed exercises stated in objective terms. And those are areas that we see a lot that are missing when we get these requests for health club memberships. If you scroll down, even down to work conditioning and work hardening, you're going to see that in that section, Section D, again, the provider needs to indicate what the indications are for this and the requirements. And then they also give a treatment period that's outlined and the requirements as far as the documentation that needs to be provided if additional treatment periods are being requested. Okay, so let's go on to durable medical equipment. The durable medical equipment in the treatment parameters that requires prior notification are purchase or use of electrical stimulation or traction equipment that's going to be used longer than a month, and also home exercise equipment. These are listed in the treatment parameters that deal with the low back, the thoracic spine, the neck, and the upper extremity. And they're all in Subpart 8. A lot of those areas have very similar wording. Kathy's just pulled up the treatment parameter for low back pain, or the chapter that's for low back pain, and she's going to scroll down to Subpart 8, which is going to show us the durable equipment requirements for prior notification, or the durable equipment that requires prior notification. So you can see that it's in the B and C, which would be electrical stim. So for instance, your TENS units that are being used more than a month, the traction, and then exercise equipment as well. So for instance, bicycles, treadmills, stair climbers, etc. Those also require prior notification. Okay, thanks. And then we go on to the next, which is non-emergency inpatient hospitalization or non-emergency inpatient surgery. So technically, according to this rule, prior notification is not required if it's outpatient surgery. I will discuss a little bit later on, though, why getting prior approval is important and helpful to you. So we'll go on to the next item. The fourth category that requires prior notification would be departure from the treatment parameters that limit a duration or type of treatment. So for instance, if you go into the rules for the neck, the thoracic, the low back, and the upper extremities, the passive and active treatment is limited to a maximum duration of 12 weeks. So if the provider wants passive treatment beyond 12 weeks for any of those body parts, they are required to give prior notification. Another example would be in the treatment parameters, it doesn't recommend a lumbar MRI earlier than 8 weeks unless there's certain types of, for instance, you suspect discitis, they've had a prior surgery, they're having cauda equina syndrome. There's criteria there that allow it, but otherwise Otherwise, a lumbar MRI earlier than 8 weeks after an injury really isn't recommended. And so that would be another situation where you would be giving prior notification. Okay, and then if you get into 52216050, which is the same area, subpart 9, about prior notification in section B, it also includes the types of information that needs to be provided when you are requesting prior approval or you're giving prior notification. We need to know the diagnosis. We need to know whether the treatment is consistent with a parameter. We need to know the basis for a departure if a departure is being requested and the treatment plan. And most of the time, this information we can find in the medical notes that accompany the orders, and that's why we need to have the medical records, because we're doing utilization review, and we need to know why the treatment is being ordered, what the rationale is, so we can determine if it's consistent with the treatment parameters, and so we see what a basis might be for a departure if that's what's being requested. Kathy, if you want to try to click onto the rule, to subpart 9B, we can show them how it's detailed in the rules. I think it was in B. So if you go up to B a little bit, 9B. There you go. So subpart A lists the types of treatment that requires prior notification, and in B, it talks about what the healthcare provider needs to provide, the diagnosis, the rationale, etc. So now if we go on to timing, the provider must give prior notification at least 7 working days before treatment is initiated, or in the case of having a departure for an incapacitating exacerbation or an emergency, the provider needs to give notification 2 business days after the treatment is initiated. So those are responsibilities that the provider has as far as the time frame. And that also is still in that subpart 9 that deals with prior notification of treatment. Then if you go on to subpart 9C, the insurer must respond in 7 working days to the requests for treatment that are listed, those 4 areas I was talking about. So you will notice that the 7 working day response is not required for all prior approval requests, only those that are outlined in these treatment parameters, those 4 areas, the inpatient hospitalization, inpatient surgery, the DME, departure from the treatment parameters, and then the work hardening and work conditioning, or the chronic management modalities. Now, the response that the insurer gives can include several. The response has to be to either approve or deny the treatment. The response may be to request additional treatment or information, requesting a second opinion, or they may be requesting an IME. So some examples, and I've dealt with this a couple times in the last few weeks. I had a request that came to me for a referral to another facility, and the orders didn't say why the person was being referred. There was nothing in the clinic notes that talked about why they were being referred, and I couldn't figure out what was going on. Well, it turned out that the patient was receiving OT and PT at this particular facility, and their occupational therapist was leaving. And so that's why they were referring the person out. They were referring them out somewhere else so that they could get occupational therapy, but I didn't know that. So my response, and I followed it within the 7 working days in response to the prior notification, was that I needed additional information. And so that 7 working day requirement was met. I met that because I responded, and then and then once I get the information from the provider, then that 7 working days, will click in against, because I need to then respond as to whether or not the treatment is approved or denied. Another example I had, we had just shown you some of the rules that are in the chronic management modalities regarding the health clubs and regarding work hardening, et cetera. I got a request from a provider for a gym membership. There was nothing in there indicating why that this was being ordered. Was the person deconditioned? Could this not be accomplished at home? And there was no list of what types of specific exercises or program the person was supposed to follow while they were in the health club. So I responded back within the 7 working days to the provider and sent a letter regarding what I needed. And then once I get that information, I'll be able to respond. Okay, so going on, and Kathy, why don't you pull up this rule? In this same section, 52216050, in subpart 10, it states that the insurer can delegate the response to prior notifications to a certified managed care plan. So that's why when you're dealing with Corvell and you're dealing with an employer that's enrolled in our certified managed care plan, that's why you have nurse case managers here that are responding to prior approval requests for treatment versus the adjuster. Now, one of the things that I do want to point out, though, in terms of the differences between the nurse case manager role and that of the adjuster, is that our case managers do not determine compensability. We don't determine what conditions or body parts are covered under the claim, and we do not schedule IMEs. Those are done by the claims rep. But if we do find out, that, for instance, there's a prior approval request and the insurer does say, well, we're going to be scheduling an IME. As you recall, that is one of the responses that can be given in response to a prior notification. So out of courtesy, we will let you know that, because we don't want to have that prior notification just sitting there without any response to the provider. But we don't have anything to do with scheduling IMEs. That's totally the insurer's responsibility. That's not the role of the case manager. Okay, so even though prior notification is not required for all treatment, the treatment must still meet the Minnesota treatment parameters. So I included an example in here of what the treatment parameters are listing under the section for the low back. And I pulled up subpart 3H, which is under the passive treatment modalities, and it's specific to manual therapy. So what you will see, and you may remember from what we talked about, you'll see if you go down to H3, the maximum treatment duration is 12 weeks. And according to the prior notification rules, if you are going to be requesting treatment that is a departure from the rule that indicates a treatment duration, you do need to provide prior notification. But you also still need to follow the rest of these rules here. There still is the rule that says, number 1, a time for treatment response is within 3 to 5 treatments. Number 2, maximum treatment frequency up to 5 times a week for the first 1 to 2 weeks, decreasing in frequency thereafter. So even though there is not any kind of a prior notification requirement for that, you still have to follow, the treatment parameters, and treatment still has to be medically necessary. So keeping in mind this slide, let's go on to the next one. The rules say that treatment must be medically necessary. There's also a rule in the treatment parameters that says that treatment can be consistent with the parameters, but it's not medically necessary treatment. So in other words, the example I just gave you indicated that in the first 2 weeks, the person could have up to 5 times a week of manual therapy. But that still has to be medically appropriate. It may not be medically appropriate for everybody to have treatment 5 times a week. The treatment parameters also list a maximum duration of 12 weeks, but it may not be medically necessary for somebody to have 12 weeks of treatment. We get questions about this a lot, and it seems like most of the questions we get about that duration of treatment come from the chiropractic community. And one of the questions I've had to answer is, we're entitled to 12 weeks. but I have to show this rule here that says treatment has to be consistent with the parameters, or could be consistent with the parameters, but it may not be medically necessary. In other words, not everybody that has a work comp injury, no matter their severity or what body part, et cetera, is going to require 12 weeks. Everybody is different. So you still have that, the treatment still needs to be medically necessary. So the Corvell case managers in our certified managed care plan, we do medical necessity reviews that are concurrent, you know, with current treatment. They're prospective for future treatment, and they're retrospective. There may be times where there's treatment that's already been provided and we don't know about it, and then we review what's already been provided as to whether or not it's medically necessary and appropriate per the Minnesota treatment parameters. Just so that you know, those retrospective reviews are rare. And the reason they're rare is because our nurses are constantly reviewing treatment to make sure it's within the treatment parameters as the person is treating. So going on to the next slide, you're probably wondering, why would I request prior approval of treatment if it's not required in the treatment parameters? And I can give you a lot of reasons why. First of all, number one, if you're working with Corvell, we send out certification letters when treatment is approved. So if you're requesting prior notification for treatment, you know you're going to get documentation that treatment is approved. The other thing you need to know is that our case managers do not certify treatment without agreement from the claims representative or the claims adjuster. So you know that you have that approval has already been agreed by the insurer as well. The second reason that it's an advantage to you to request prior approval is that it avoids those retrospective reviews where treatment's already been administered and then you find out it's not medically necessary and you've already provided the treatment. And as I said, these reviews are rare here at Corvell because we actively review treatment, and our reason is to avoid this. Third reason, which is probably the one we run into the most, is that we have to remember that the treatment parameters are for compensable workers' compensation injuries. So the adjuster determines compensability, they determine covered body parts, and they determine the conditions that are covered under the injury. We always have that checked out before we certify any treatment. We aren't going to certify any treatment until we have been told by the adjuster that it's a compensable injury and what body parts are covered. And then, as I noted, they also let us know if they agree with the treatment we're certifying. I have just run into this so many times in the last few weeks. We run into this a lot. I recently received a request from a provider for an elbow injection. And granted, really, technically, according to the treatment parameters, unless it was multiple injections, the provider didn't even need to give me prior notification, but it's good that he did, because it was for an injury where only the neck and back were covered body parts. And just so that you know, when we do get these types of requests, I mean, we also verify with the adjuster whether or not there's been a change as far as the covered body parts. And I verified with the adjuster, okay, this elbow is, you've told me it's not covered. Is that correct? So that would be an example. I also had a situation recently where the low back was the covered body part. Physical therapy had been approved, and then they requested additional visits, but all the documentation I got was that the additional visits were now being ordered for the thoracic back. And so I did verify with the adjuster, and they did tell me that now the thoracic was covered, but that's an example of making sure that you're treating compensable injuries, you know, and compensable body parts and conditions. Another common one that we see a lot is a knee injury that might be accepted for a knee strain or a meniscus, you know, a knee injury that maybe occurred just about 3 or 4 weeks ago, and they're accepting it for the meniscus tear, and then all of a sudden we're starting to get requests for Synvisc injections for significant degenerative osteoarthritis or a request for a total knee arthroplasty. And the diagnosis of osteoarthritis is not covered under that knee injury. Another example, too, is that I just thought of when I was reviewing this was there have been some recent additions to the Minnesota Workers' Comp rules regarding PTSD. And one of the rules requires that the diagnosis of PTSD under Minnesota Work Comp be made by a licensed psychologist or psychiatrist. And we oftentimes will see requests come in from a provider for counseling for the diagnosis of PTSD, and the diagnosis was made by, you know, an internal medicine specialist or a family practice physician. And so that's another situation where we have to go to the adjuster and to say, you know, is PTSD covered? And a lot of times they won't accept it because it's not meeting the Minnesota Work Comp rules. A fourth example of why it's advantageous for you to request prior approval. We oftentimes have injured workers that request to get a second medical opinion. And so you might have your provider seeing somebody for a second medical opinion, but then they go ahead and they start ordering treatment. It's important to understand that only the second opinion was approved, not treatment. And the reason that we're very careful about that is because under the work comp rules, the employee is to have a primary treating provider that's directing the treatment. And if they've requested a second opinion with somebody else, that's just a second opinion. If they want to then treat with that other provider, they have to request to use their change of provider option. So when somebody's only approved for a second opinion, that's all they're approved for, not for treatment. So that's another thing to keep in mind, why it's real important to request prior approval. Number 5, you may have a primary treater that refers a patient on to another consulting provider for an evaluation. And the rule, which I did list here, is very specific that if that consultant then feels that another referral, for instance, a referral for diagnostics, a referral for therapy, or even a referral to another specialist, if they're recommending that, that needs to be coordinated with the original treating provider, unless the consultant has been now approved as that treating provider. Okay, I want to touch a little bit about massage therapy because under the Minnesota Work Comp rules, massage therapy is confusing. I listed the definition 6040 that lists massage as a passive treatment modality, and in subpart 12, where it lists examples of passive treatment and what that includes, you will see towards the end of the sentence that it does include massage. So massage is included as a modality that is allowed under workers' comp rules. But if you go on to the next slide, the work comp rules do restrict who can provide the massage modality. Because if you go into the statute, which I've got listed here, 176135, it talks about complementary and alternative health care providers. And it says that any service, article, or supply provided by an unlicensed complementary and alternative health care practitioner is not compensable under work comp. And if you go into the statute 146A that I listed, it defines what an unlicensed complementary and alternative health care practitioner is. They're not licensed or registered by a health-related licensing board or the Commissioner of Health. So for instance, we have nurses that are licensed by the Minnesota Board of Nursing. You know, you have chiropractors that have a health-related licensing board that they're licensed by, physical therapists, et cetera. But going on to the next slide, currently, unless something just happened, currently there is no health-related licensing board for massage therapists. And so we have to be careful when we get a request for massage. We don't have massage therapists listed in our Corvell Certified Managed Care Network because it does not meet the rules, and we don't have any means of credentialing them because they're not licensed by a health-related licensing board. We do allow massage therapy treatment, though, if it is provided by somebody licensed by a health-related licensing board and within their scope of practice. or the massage therapist is working under the tax ID number of somebody licensed by a health-related licensing board. So they're not just renting space. So we have seen that there are a lot of physical therapy clinics and a lot of chiropractic clinics now that have massage therapists that are working with them. What I've seen a few years ago is that oftentimes they were just independent contractors that were renting space, you know, and they were not billing under the tax ID number of that health-related, you know, that provider who is licensed by health-related licensing board, the PT or the chiro. But I'm seeing that change now, and that is a means of how we can allow massage therapy. Otherwise we aren't able to. Now, before I go on to report of workability requirements, does anybody have any questions? Doesn't look like there's anything on the chat pane for this section. Okay, good. All right. It doesn't mean you can't ask later. So go ahead. Okay, so as far as report of workability requirements, the physician is to complete a workability form at the initial evaluation and at every visit if the visits are less frequent than every 2 weeks. So for instance, if you have a provider that's seeing somebody every month, they should be filling out a workability form at every visit. If the visits are more frequent than once every 2 weeks, they should be giving them an updated workability note every 2 weeks. And then they also do need to give an updated work note upon the expiration of the previous workability. So a lot of times the workability forms might say this is in effect until December 1st. So that patient needs to get in and get an updated workability form from the provider on or before December 1st. We've got some information on this slide about where you can fax or email the workability forms to the case manager within 24 hours of the appointment. There's our fax number. We also have the email address for our referral center, or you can call the case manager. Kathy, if you want to try to link on to the rules where the workability is addressed, I think that'd be helpful. So you can see that it's in 5221. I believe it is 0410, reporting, the required reporting.
Yes, it is. I have it up.
Okay, great. And then going on to the next slide, and this is straight out of the rules as well. The workability form must include information about the employee and the employer and insurer if known, but particularly the employee. We need to see the employee's name on there. The date of the most recent exam, information stating whether or not the employee is able to work without restrictions or with restrictions or unable to work. Number 4, the work restrictions need to be stated in functional terms if the employee is able to work with restrictions. So for example, I just had this a couple weeks ago. I had a note that said that the employee is able to work light duty. And there was nothing defining that. And I think the physician would understand that light duty can be different with somebody that has a shoulder injury versus somebody who has an ankle injury or has a knee injury. And also, I don't think that they really want the employers trying to figure out what light duty means. The safest approach to this is to have the doctor outline in functional terms exactly what the work restrictions are. And then number 5, the work note needs to include the date any restriction of work activity is to begin and the anticipated ending or review date. Number 6, the date of the next scheduled visit. 7, it should have the signature of the healthcare provider, license registration number, and identification information, and then also a notice to the employee that a copy of the report must be promptly provided to the employer or the work comp insurer or assigned QRC. So that's real important. And getting back also to number 4 about being stated in functional terms, sometimes the providers will say, you know, they can't do this they can't work in on floor 2B or in room A or whatever, and that is not stating functional terms. They need to state what the functional terms are, and then that way the employer is able to figure out where they can provide appropriate work for them that's within the work restrictions that the doctor outlines. The report of workability has to be based on the healthcare provider's most recent exam of the employee's signs, symptoms, physical and clinical findings, and the functional status. And if you want to try to access, Kathy, 0420-5221-0420, where it says that the healthcare provider must release the employee to return to work with restrictions if necessary at the earliest appropriate time. That is in, I believe, the first, I think it's in the first, they must cooperate. Yeah, it's in that first paragraph, the last sentence. The healthcare provider must release the employee to return to work with restrictions if necessary at the earliest appropriate time. It's under subpart 1, the first paragraph. Thanks. Okay, and referrals, going on to referrals. In certified managed care, if you have somebody that's enrolled in certified managed care plan, all referrals must be made to a provider in the Corval Certified Managed Care Provider Network. We list the statute here that says that an employer may require that treatment and supplies that are required under work comp be provided in whole or in part from a managed care plan certified, under Section 176. Hence the name Certified Managed Care Program, because we have to be certified with the Department of Labor and Industry. Our next page gives you some information about how you can access our network. You can contact the medical case manager. You can contact our referral center, but you can also go online and look at our network if you need to find out, who providers are that are within our network. If a participating network provider is not available, contact the assigned medical case manager, because we may then have to look at whether or not to refer to a non-participating provider. Our network is huge. We have thousands of providers in the state of Minnesota. But if you're getting into a real specific specialty and it's somebody that lives outstate in a rural area, a lot of times it is difficult to find somebody that's within network, and so we do look at options as far as allowing them to treat out of network. Okay, and then
Joanne?
contact. Yeah. Yes.
I just want to point out that when we talk about looking at selecting the network, which is right here, find the provider, select a network, there is a drop-down for work comp. That is not what you want. You want to make sure it says Minnesota Certified Managed Care. And that fools people sometimes, because there are two different networks. So there is one that says work comp. That is not what you want to be in. You want to be in Minnesota Certified Managed Care.
Right.
Thanks.
Actually, there's probably about 12 to 14 networks that are listed there, because this is our national directory, and Corval is throughout the country. So we have different networks in different areas, different states, et cetera. But the first option is workers' comp, and that does tend to confuse people. You do need to choose the Minnesota Certified Managed Care Network. Thanks for pointing that out, Kathy. Okay, and then on the next page, we have our fax number, our phone numbers, email address for the referral center in case you have any questions going on. We have some links to the work comp statutes and rules. And I want to thank you all for attending. And I think you do have our contact information, so if you do have any questions after this presentation, feel free to contact Kathy or me. You can call and ask for either one of us. And I want to thank you for participating. Okay, Matt, we don't have anything else?
Okay, thank you, Joanne. Thank you, Kathy, for presenting today, and thank you to everyone for attending. And we have recorded the call and we'll be posting it on corvel.com, and we'll be reaching out to all the invitees once we have that posted. So thank you again, and have a very pleasant rest of your day.